Hello, hello. My name is Alicia Carson. Welcome to my YouTube channel. This is my educational video for those of you who may be new to Medicare in 2022 or may already have Medicare and just have some questions that are frequently asked. I am a licensed agent. I'm an independent licensed insurance agent, and I've been licensed since 2016. I'm licensed in over 22 states. I am excited that you have chose me as your licensed agent to be able to share this basic information and educate you all on how Medicare works and some basic information that you might have been wondering about, like you know when Medicare starts, who's eligible, and what the co-payments and co-insurance and premiums looks like, as well as who can use Medicare and what penalties might be assessed. So this video is strictly educational. I will not be speaking to any specific insurance carriers today. Although I do represent multiple carriers, I am not married to just one carrier because I like to be able to help my clients look at their options. So again, thank you for joining me. I'm going to go ahead and share my screen so we can get started. And I want to start by congratulating you all who are new to Medicare and are newly eligible. Congratulations, you have made the cut. And let's talk about what that looks like. Okay, first and foremost, the history of Medicare. Medicare started back in 1965, and it is a government health insurance benefit, not to be confused with Medicaid, which is a lot different. Medicaid is for anyone who has below a certain income level. However, Medicare is for people who have worked a certain amount of time and who have paid into the benefit and now qualify for Medicare. Typically, people enroll into Medicare through their Social Security Administration when they get their Social Security benefits, usually around retirement age. However, some people who also are disabled qualify for Medicare before they turn 65. Medicare is administered and regulated by the Center for Medicare and Medicaid Services. Okay, so what does it mean to be eligible for Medicare? Well, the rule of thumb is that you had to have worked 40 quarters, which is equivalent to about 10 years. And you have to be receiving Social Security benefits. So usually when you reach age 65, however, some people are also receiving Social Security benefits due to a disability. And those people who have been disabled for 24 months or longer may also qualify or be Medicare eligible. Then you have people who have end-stage renal disorder, also known as ESRD. They may also qualify for Medicare benefits and start receiving those benefits after 4 months. And lastly, we have those people who are eligible because they are married to someone who is living or someone who has passed away who was Medicare eligible. Okay, so typically those are the 4 different ways you can qualify to receive Medicare Part A and Part B. Let's talk about what it looks like once you actually have been deemed eligible and now receiving Medicare. Okay, so Medicare is broken up into parts. Some people are automatically enrolled into Part A, which is hospital coverage, even while they're still working after age 65. However, when you couple A, hospital, with Part B, medical, that is called original Medicare. And There can be penalties assessed for delayed enrollments. In some cases, that applies to Part B and also Part D, which is for drugs. While Part A and B are issued by Social Security generally, Part D is sold by private insurance companies, also known as carriers. Part C, also known as the Medicare Advantage Plan, is also sold by private insurance companies and carriers. Part C is not an additional benefit in addition to original Medicare. However, original Medicare is required in order to be eligible for Part C, and you do have to continue to pay your Part B premiums, which we will talk about in a moment. However, Part C is an alternative to original Medicare. Medigap, or Medicare Supplement Plan, is in addition to original Medicare. It works along with original Medicare to help supplement coinsurance, deductibles, and other costs associated with original Medicare not covered by Medicare. We'll talk more about that in detail to hopefully clear up any confusion you may have regarding the two completely different benefits. Okay, let's first talk about original Medicare and the two parts, Part A and Part B, and how they work. Part A, hospital coverage, typically has no premium as long as you have met the requirement of working 40 quarters or more. However, there are some people who qualify for Medicare Part B and not Part A, and they're left with a premium of up to $499, depending on their qualifying work history and other factors. Once you are enrolled in Part A hospital coverage, there is a deductible of $1,556 per every hospital occurrence with a gap of at least 60 days. What does that mean? What that means is if you were to be hospitalized, God forbid, on January 1st, and you met that deductible of $1,556, and you become hospitalized again within the following 60 days, you are not expected to pay that deductible again. However, if you were hospitalized on January 1st, released January 14th, for example, and went back to the hospitals after 60 days, for example, March 20th, you are going to be expected to pay that deductible again. So already with 2 hospital stays with a 60-day gap, you're out over $3,000 with original Medicare. While it is a very good benefit, it definitely helps a lot of seniors afford healthcare costs they would not be able to afford in other ways. It is still a benefit that leaves a lot of out-of-pocket costs and risks to the beneficiary. Not only do you have the deductible, but you also have copays or coinsurance. And if you are hospitalized beyond 60 days, day 61, you start to pay a $389 copay per day up to day 90. If you're hospitalized more than 90 days, on day 91, you start to deplete what is called your lifetime reserve days. And there are copays that apply for those days. It's typically up to 60 days that you have for lifetime reserve days. And for each day after day 90, it's a $778 copay. Okay. After that, if you're still in the hospital beyond those lifetime reserve days, you do assume full responsibility for any hospitalization costs. Now, Part A hospital coverage also applies to skilled nursing facilities, rehab, for example. And if you are in skilled nursing facilities, your Part A coverage will cover the first 20 days with a $0 copay. However, day 21 up to 100, there is a $194.50 copay, and it only goes up to 100 days. Okay, so let's talk about Part B and the costs associated with the Part B coverage. Part B covers medical specifically, and that applies to, for example, doctor's visits, diagnostic tests. And in 2022, the premium starts at $170.10, and that increases for those who have higher incomes up to a maximum of $578.30. So while you won't make too much money to qualify for Part B coverage or for Medicare per se, it is possible that you would have a higher premium if you have a higher income. For income limits, you can refer to CMS or the Center for Medicare and Medicaid Services. Part B deductible then kicks in after you've paid the premium and enrolled into Part B coverage, and it's $233 annually. Not like the Part A deductible, which is per occurrence, but the Part B deductible, in addition to Part A's deductible, is an annual deductible of $233. And after that is met, Medicare will pay 80% for covered healthcare services, and your responsibility will be the other or remaining 20%. Now, for some people who are low income, they may qualify for Medicaid, which is specifically for people of all ages that have low income, and Medicaid may, or the government may help pay that Part B premium. If you can't afford it, you would apply through your state Medicaid office. Part B, if delayed, and you don't have any other credible healthcare coverage as good as Medicare's, could cause you to be assessed a penalty, and that penalty this year is 10% of the current Medicare Part B premium for every 12-month period that the person has delayed enrolling into Medicare Part B after they were first eligible or dropped Part B coverage and were without Medicare Part B coverage. So be very careful that you don't go without other credible coverage if you choose not to enroll in Part B, or that you enroll in Part B when first eligible. Okay, now I want to talk a little bit briefly about Part D. Again, Part D is sold by private insurance companies, unlike Part A and Part B. And Part D, as in David, is known as the drug coverage. Part D, like Part B as in boy, has a late enrollment penalty for those who delay their enrollment with no other credible drug coverage. So even though it's not something that's issued through the Social Security Administration office, if you don't enroll into your Part D coverage when you're first eligible and you choose to enroll later, you will be assessed a 1% penalty, which will be 1% of the national base beneficiary premium for each month that you didn't have Medicare drug coverage. So even if you don't take drugs and you're new to Medicare, if you don't have other credible drug coverage, it is recommended that you enroll into your Part D when you're first eligible to avoid that late penalty, of course. Now, of course, with Part A and Part B, hospital deductible and co-insurance and co-pays, there's a big risk of having to spend a lot of money. You know, typically we like to go to the doctors once a year. However, as we get older, our body starts to move a little bit slower. It sometimes breaks down, and you know, the food that we ate back in our 20s, 30s, and 40s start to catch up with us. So in 2021, to offset those costs, about 46% of Medicare beneficiaries opted into a Medicare Advantage plan, also known as a Medicare Part C plan. About 29% chose to do a Medigap plan or a Medicare supplement plan with original Medicare instead. Now, oftentimes people will confuse a Medicare Advantage plan and a Medicare supplement plan. So I'd like to take this time to break down the difference between the two and how they work, as well as the pros and cons. Okay, to start, original Medicare is necessary to qualify for either a Medigap plan or a Medicare Advantage plan. You cannot be enrolled in only Part A or only Part B and then get a Medicare supplement plan or a Medicare Advantage plan. So having Part A and Part B is like having the key that opens the door to more benefits or more coverage, if that makes sense. Okay, so if you've ever been in a situation where you were only enrolled in Part A hospital coverage and not Part B, or vice versa, enrolled in Part B medical coverage and not hospital coverage, and applied for a Medicare Advantage plan or a Medicare supplement plan and been turned down, that is the main reason why. Okay, once you have Part A and Part B, original Medicare, you can then add to it as you see fit. If you have other credible drug coverage and you want to leave out the Part D coverage, you can go with a la carte vision, a la carte dental. You can even add on a Medigap plan to supplement those deductibles and copays that we talked about that are with Medicare Part A and Part B. Okay, if you have original Medicare Part A and Part B and then want to enroll in a Medicare Advantage plan, you can also do that. And then you will essentially swap out your original Medicare for what is called Part C or a Medicare Advantage plan. It sort of bridges the gap or puts everything together. So with Part C, you have your Part A and B hospital coverage, which you have to maintain both in order to qualify to stay on your Medicare Advantage plan once enrolled. And then you also have whatever else is included in the plan. Typically, nowadays, depending on your zip code, you'll see that the plans will include dental, vision, and hearing benefits, sometimes over-the-counter benefits, fitness memberships, and much more. Okay, and so these benefits are services that original Medicare usually does not cover. However, a Medicare Advantage plan will cover those benefits in most cases, and you would speak to a licensed agent in your area or who is licensed to sell in your zip code to be able to find out what your options are. Okay, so what is a Part C or Medicare Advantage plan when you break it down? A Part C or a Medicare Advantage plan is the exact same thing. There is no difference between the two. I just want to clarify that. Okay, Part C, Medicare Advantage. Part C, Medicare Advantage. Part C is the same thing as a Medicare Advantage. And by law and by regulation of the Center for Medicare and Medicaid Services, it has to offer the same coverage as original Medicare and more. So typically these plans will have Medicare hospital coverage and Medicare medical coverage. It may or may not have a health deductible. They typically do have copays for hospital visits, but they're a lot lower than what original Medicare is usually. And in some cases, they also include prescription drug coverage. There are two types of Medicare Advantage plans. You have your Medicare Advantage prescription drug plans, which are essentially A, B, C, and D in one. And then you have your Medicare Advantage only plans, which are essentially Medicare Part A and B, and then those other benefits, but they don't include D. So depending on whether or not you have other credible drug coverage, you may choose to go with a Medicare prescription drug plan or a Medicare Advantage only plan. Okay. Now, when you talk or speak to a Medicare Advantage plan, typically you will see that Medicare Advantage plans usually have very low monthly premium costs. Most of the times it's a $0 premium. Now you may be wondering, how is it that I can get hospital coverage, medical coverage, dental coverage, vision coverage, all these great benefits, and it's $0? Sounds too good to be true. Well, A lot of people have thought that, but there's no gimmicks to it. The government pays these private insurance companies to assume liability and cover you under their plans. And since they pay the premiums, or since they pay the insurance carrier, typically you'll see very low monthly premiums down to zero. And these Medicare Advantage plans are very similar to the group health plans that you might find at your employer or last employer. For example, they include networks such as PPOs, HMOs. They even have HMO with point of service option, and also provide a fee-for-service plans. Okay, you must remember that you have to continue to pay your Part B premium in order to stay covered under your Medicare Advantage plan. You cannot go on to a Medicare Advantage plan and decide to stop paying your Part B premium. You will be disenrolled from the Medicare Advantage plan, as it is a requirement that you have Part A and Part B to qualify. So while a Medicare Advantage plan will pay instead of original Medicare, you do have to be enrolled in original Medicare to qualify for a Medicare Advantage plan. Okay, next we're going to talk about a Medicare supplement plan or a Medigap plan. And these two are the exact same thing. Medicare supplement, Medigap. Supplement, Medigap. Medicare supplement, Medigap are the exact same thing. There is no difference between the two. A Medigap plan is designed to be coupled with original Medicare. Okay, so whereas in a Medicare Advantage or Part C plan, you would just have one card, which is whatever card or a Medicare Advantage plan that you join, you would use that one card at the doctor's office. A telltale sign that you have a Medicare supplement is that you use both your red, white, and blue card, as well as your supplement plan G, for example, and then you have a separate card for prescription drug coverage, dental, and vision if you choose to enroll in those things a la carte. With the Medigap plan, you have to, again, have original Medicare Part A and Part B to qualify or to be covered under a Medigap plan. It's not a standalone coverage that you can use by itself. Okay, if you were to go to the doctor's office and Medicare paid their 80% of $100, which was $80, your Medigap plan is designed to pick up the $20 that's left over, or whatever that 20% coinsurance is, depending on the level of supplement coverage. Level of supplement coverage that you have. Plans range from A through N. Okay. Be sure that you speak to a licensed agent to understand how those plans work, because while supplement plans can provide up to 100%, there are some supplement plans that are relatively just not good plans when it comes to filling in those gaps of coverage, and they leave a lot more risk. So to understand how a plan G is different from a plan N or a plan K, it's important that you understand the difference. And so that's what we licensed agents are here for. We're here to help you understand coverage and make the decision that's most suitable for you. Okay, now with the Medicare supplement plan, typically they are federally standardized plans, except for very few states that have core benefits and then add-on benefits. Typically a plan G is a plan G is a plan G, no matter which state you're in, except for those that are the exception. For example, Massachusetts is one of the exceptions. Okay, now with the plan G, the only thing that is not covered from original Medicare is that $233 deductible for Part B. Outside of that, when you go to the doctor's office and you have a 20% coinsurance, the plan picks up that 20%. If you have a surgery and you have a 20% coinsurance, the plan picks up that 20%. If you have a hospital deductible for your hospital visit, the plan picks up that deductible. And so because these plans provide up to 100%, they can be a little costly, and the rate depends on your zip code, your age, and your sex. So let's talk about the pros and cons. Let's start with Medicare Advantage plan, pros and cons. Okay, so with a Medicare Advantage plan, it's more of a plan where you can kind of pay as you go, if that makes sense. Because although it does have some copays typically, for example, you may have a $0 to $10 copay for your primary care doctor. You may have a $15 to $30 copay for $15 to $50 copay. You know, it ranges for your specialist. You may have a $90 copay for the hospital visit, or a $250 copay. These are just general numbers. These are not to say that, you know, that is a set range for every insurance carrier or Medicare Advantage plan. But just to give you an idea, you're not paying any monthly premium. Usually, if it is a monthly premium, it's usually very low, under $100. But typically it's a $0 monthly premium. And so the pro to having a Medicare Advantage plan is usually low monthly premiums. Okay, if you don't go to the doctors very often, you have very little out-of-pocket costs. If you go to the doctors often, then your out-of-pocket costs will be accumulative to how often you go to the doctors or need covered healthcare services. Usually it also includes drug coverage. So if you are newly 65, you want to make sure you get your Part B, and you want to get your Part D as well and avoid any late penalties. Enrolling in a Medicare Advantage plan can be pretty simple. You can go ahead and get a Medicare Advantage prescription drug plan, which will include prescription drug coverage. You can also put in your drugs with your carrier or insurance company's website to make sure your drugs are covered and included in the formulary and will be affordable for you. Also, Medicare Advantage plans usually or may include dental, vision, hearing, and other benefits. Now, not every plan includes dental, vision, and hearing. Some plans will provide preventative services, and some plans will provide comprehensive services. It's always good to review the summary of benefits or evidence of coverage for any Medicare Advantage plan that you plan on enrolling in or considering, being covered under. Now, the maximum out-of-pocket, or MOOP, is also a pro when it comes to Medicare Advantage plans, because unlike original Medicare, where that 20% can be $20,000 out of 100, or $20 out of $100, you know, $20,000 out of $100,000, or $20 out of $100. The maximum out of pocket is designed to make sure you don't get to $20,000 of out of pocket expenses. If anything, those are typically around $3,500 up to $7,500 in network. However, there are some PPO Medicare Advantage plans with out of pocket maximums as high as $11,000 for out of network services. Now, that is not a deductible that you're required to meet before your services are covered. However, it is a cap on your responsibility. So if things got really bad and you had a $100,000 bill on a covered services, you would be expected to pay your copays. And if your copays got to the point where your out of pocket exceeded that cap amount, the insurance will have to cover 100%, and your copays would essentially go away. Now, that's not to be confused with the prescription drug coverage maximum out of pocket, or TROOP, which is completely different. We'll talk about that in a different video, not to confuse you all. Okay, Medicare Advantage plans are ideal for those with a lower fixed income compared to Medicare supplement plans, again, because of that low monthly premium cost. Um, and another thing is Medicare Advantage plans don't have underwriting requirements. So if you've dealt with cancer in the past or have had issues with COPD or some of those chronic illnesses that may deny you a Medicare supplement plan, if you have to go through underwriting and you are no longer in your guaranteed issue period, which is a period when you first turn 65 that allows you to skip underwriting, then a Medicare Advantage plan may be best for you. Now, some cons to a Medicare Advantage plans that people typically don't like is the fact that it has networks. Now, again, a network is like PPO, Preferred Provider Organization, or HMO. People sometimes misunderstand how networks work, and they are afraid that they won't be able to see a doctor that they like, or that if a doctor is out of network, they won't be covered. And if you have a PPO plan, you can use both in and out of network providers as long as they accept the plan. However, having a network does mean that you could pay for services that would essentially be covered if you see a provider that is not accepting the plan or is not in network on an HMO plan, for example. Okay, HMO plans do not typically have out-of-network benefits. However, in emergency situations, your HMO may cover you at an in-network rate. Now, Medicare Advantage plans also have yearly contracts, so you cannot just enroll into a Medicare Advantage plan and start that today, and then 2 weeks from now say, I decided I found something better. No, you need to take your time and find a plan that you like, because it's designed to be your plan at least for a year or until the end of the plan year. There are certain time periods, for example, if you relocate, if you lose employer coverage, or if you move to an area that has a 5-star plan, you may be allowed to disenroll from your plan at that time. Also, people who have Medicaid and are low income are allowed to make a little bit more changes than a typical person. Another con for some people is that it's not an a la carte thing. You can't find a Medicare plan and say, oh, I love that it has $4,000 in dental coverage, but I don't need prescription coverage. I want to drop that. Or I love that it has great prescription coverage, but I don't like the copays. I want to switch that out. No. Once you accept the Medicare Advantage plan, enjoy the plan, that is your plan. You don't get to change things about the plan or do things a la carte like you do with the original Medicare and a Medigap plan. There are some co-pays and co-insurances to be expected. Again, you're not really spending money up front. You're more so paying as you go along. So some people don't like that. Some people would rather pay money up front and have the peace of mind that they're not expected to pay any co-pays or co-insurances when they go to the doctors. And that depends on your situation. Not everybody's the same, and there is no one fits all. Okay. Now let's talk about the pros and cons of Medicare supplements. Okay, so a lot of people like that Medicare supplements do not have any networks. There's no checking to see if your doctor is in the plan, no difference in co-pays or co-insurances in and out of network. You don't really have to worry too much about that as long as you know how your supplement plan works, whether it's a plan G or a plan N. It's typically the same as long as your doctor accepts Medicare. Now, there are some doctors who do not accept Medicare assignment, and they can upcharge you up to 15% for some Medicare covered services. Up to 100% coverage for Medicare covered services is another pro. There is little to no copays. So typically for a Medigap plan, you may pay anywhere from $100 to $200 starting out at age 65, depending on your zip code, with New York being one of the states that has a more higher cost for supplement plans. And that's not to quote any carrier in particular, that's just to give a general ballpark idea, and that's the monthly premium. So because you pay your premium upfront, depending on the level of supplement coverage you choose to enroll in, you may not have any co-pays or co-insurances when you go to the doctors. For example, Plan N, as in Nancy, does have co-pays up to $20 at the doctor's office and up to $50 at the hospital, but no more than that. Now, you can also add voluntary coverage as needed a la carte. So if you have other credible drug coverage, for example, from a military coverage or from a spouse's employer coverage, and you choose to delay your Part D, knowing that it's not going to incur a penalty, and you just want to supplement that Part A and Part B coverage as a tertiary or secondary coverage, then you can do that. And you can also add dental when needed, add vision when needed, or pay those things out of pocket. It's completely up to you with the Medicare supplement. You're also not tied in for a year. You can disenroll or enroll at any time. However, there is underwriting. So whereas a Medicare Advantage plan has certain time periods during the year that you're allowed to enroll and disenroll, a Medigap plan does not. But there is a list of health questions. And again, if you have certain chronic illnesses, you may not be able to join the plan due to those chronic illnesses. Now, Medicare supplements also work with original Medicare. So a lot of people take pride in being able to keep their original Medicare you know, as opposed to a Medicare Advantage plan. Depends on you. Some of the cons would be you have to use multiple cards. You pretty much have a different card for everything. You have your card for original Medicare, which is your red, white, and blue card. You have your supplement card. Then if you have Part D coverage, you have that card. If you have dental coverage, you have that card. And if you choose to have a vision coverage, you also have that card. So it can be a little bit more things to keep up with. So that can be seen as a con. It does not already include drug coverage. So that premium that you're paying, which can get costly depending on your age, your zip code, and your gender, does not usually include other benefits. So adding those other benefits would incur more costs. And then those rates that you start out with don't essentially stay that way. The rates do go up every year, typically with your age. Okay, so that's all now for now, folks. I hope that you enjoyed my presentation. If you have any questions or comments, feel free to give me a call at the number here, 678-643-1886, or you can email me at prosperityprincessprinciples@gmail.com. Again, my name is Alicia Carson, and I really appreciate you all watching. If this video was helpful, please share it with someone else who may need this information. If you have questions or comments that you'd like to drop them below in the comment section. I'll be happy to answer and respond. Also, please like this video and subscribe to my YouTube channel for more information. Take care. Good luck.